So, hi everyone, and welcome to the Byolete podcast, the podcast where we discuss the science behind the brand. So, a bit of a different one today. We're actually recording this podcast in the London Podcast Show 2025, and we've been kind enough to have used Spiritland. So they've got a little set in the middle of the show, and we've been able to use their set to basically record this podcast. So we discussed last week HbA1c. Obviously, the aim of our podcast is to really just shine a light on the impact of poor health, lifestyle, and what you can do to mitigate it. So it advocates for preventative health, especially having the brand Byolete, where we do the at-home blood testing. So this week we're talking about Apo B.
Yeah, so Apo B is a part of our Prevent Plus panel. And the reason why we've went with Apo B is in the UK, we tend to use LDL cholesterol or non-HDL cholesterol. Apo B encompasses LDL cholesterol, VLDL and IDL. And it's been known through studies to be a better biomarker for ASCVD.
Yeah.
So that's why we're going for it. It was quite hard to acquire on the panel.
It was, yeah. And I wanted to just point out that maybe our UK listeners may not be familiar with Apo B. If you're from America, you may be a bit more familiar with it. The reason being is that in the UK, we don't routinely test for Apo B. Like you say, it is a better marker of ASCVD, which is the atherogenicity or the atherogenicity potential of a particle. So the ability of it to basically cause a plaque to build up within your artery. Apo B is a very good marker for that. I do believe that we will see it a lot more in the UK. If we look at statins, which are obviously the most commonly prescribed medication for lowering cholesterol, if you look at the basically the licensing for it, it does discuss the fact that it can lower Apo B now, and I don't think I noticed that a few years ago.
No, it's only been in the last 6 months, I would say.
Yeah,
that it's come onto licensing.
Yeah, so I think what's important is that obviously at Byolete, like you say, it has been very difficult to actually attain Apo B because we don't routinely test it in the UK, but we are offering it. So unlike your GP, where you can go and get a full lipid profile, we do offer the lipid profile plus this Apo B. And like we say, it is potentially a better marker for really testing your risk.
Yeah, so let's go into why it is a better marker then.
Yeah.
So with LDL cholesterol, you are just basically getting a value for the concentration of cholesterol within them particles.
Yeah.
It doesn't tell you how much sort of vessels that it's split up into, whereas Apo B, there's one molecule per vessel.
Yeah.
So then you get this idea of, if you know how many molecules there are, or macromolecules, then you know how much, the tendency of them to leave the arteries to then cause the atherosclerosis.
Yeah.
And the best analogy is if you've got a street and you've got cars, if you've got LDL cholesterol, for example, which is what we're using now, we'll know how many people are within a car. So there could be 20 people. We don't know how many cars they're in, but we know there's 20 people on that street.
Yeah.
Whereas Apo B, we know how many cars them 20 people are in.
Yeah.
And obviously then the higher the number of cars, there's more likelihood that there's going to be a crash.
Yeah.
But it doesn't mean that there's going to be one.
Yeah. I think I just wanted to say as well, like, to sort of explain to the listeners what Apo B is, and it's sort of like a signal and molecule almost. It's maybe a bit like if you use the car analogy, it could be a taxi sign on a car.
Yeah.
So you can clearly know that is a taxi because it's got a yellow sign on it saying taxi. So that's sort of what an Apo B is, and that's how we can determine whether it's an atherogenic particle or not. Is that a good way of explaining it, do you think?
Yeah, it's not too bad. But it's important to know the number. Like we say, we know a concentration, but actually the number is so important because for those who don't know what ASCVD is, atherosclerotic cardiovascular disease, it's a disease progression over normally 10 to 20 years. And it's when the macromolecules of cholesterol deposit within the cardiovascular coronary wall.
Yeah.
And it's this idea that if we know how many particles have got the likelihood to do so, we can then calculate a risk. And it's all this idea of knowing the trend before it's even happening.
Yeah. I think that brings us nicely onto the point of why should people test for Apo B? And especially why should younger people test for Apo B? Again, I'm speaking for UK residents here. We don't usually get our lipid profiles tested until we're around about 40, 50. Obviously, at Byolete, we are advocating for testing a lot younger. is there a benefit to testing ApoB when you are, say, in your 20s, 30s?
Like we said, there's evidence from the age of 5, actually even before they're born, that cardiovascular disease begins then. So if you know what your number is then, you can sort of calculate. Again, it's a calculation. It's not a definitive risk.
Yeah.
And it's this idea of, do you want to know?
Yeah.
So I think it's beneficial, in my opinion. We've been tested. The results interpretation in terms of where the reference ranges lie and where you are within a population, because it's not routinely tested, that's going to come out and develop with the more tests that we do.
Yeah. And I just wanted to point out as well that there are numerous studies that have shown that it is the accumulation of a high ApoB level over a longer period of time that increases your risk. So obviously, if we know what our levels are in younger patients, so for me and you, for instance, we first got our ApoB levels tested a year ago now. So when I was 30 and you were 29, so we've got a level of what our ApoB was. And so if we continue to test it, we know how long it's been potentially high for or how long it's been, optimal for. And like you say, if you can lower the risk over a longer period of time, you're going to also lower your cardiovascular risk significantly.
Yeah. And one thing that we do want to mention is that we are including the ApoB within the whole lipid panel. So we are using it with other tests. It's not just in isolation. And we have come a long way from just your total cholesterol, which was the first test. And if you ask anyone how the cholesterol is and what risk they've got, they'll come up with a number. Normally, we aim for less than 5 in total cholesterol. But in the reality of things, it actually doesn't mean anything. We need to know how that cholesterol is being transported throughout the body, because one thing we didn't mention is actually cholesterol is impossible to go around the body unless it's within a vessel, because it's hydrophobic. It's non-miscible within plasma or water. So we just need to know how it's transported around. And the one thing we want to keep debunking is that cholesterol is not good or bad.
Yeah.
Cholesterol is the same molecule. It just depends on how it's being used throughout the body and how it's being transported.
Yeah. That's a really good, important point. I think I just wanted to finish then on the fact or just reiterate the fact that if you have a high ApoB level, so if you come to us, you get a test on it and it's high, it is actually one of the only big diseases that is, potentially going to kill us, that we can prevent and that we can mitigate the risk of. And so that's obviously why we always advocate for exercise, good diet, because actually cardiovascular disease is still the number 1 killer worldwide, but it is actually very preventable. So maybe we should just touch upon very briefly how potentially someone could lower their ApoB level. I'll go first. So we know that high ApoB level is linked with hyperinsulinemia, which is usually the pre-diabetes or diabetes, mainly type 2, but also type 1. Patients do have an increased risk of cardiovascular disease. Basically lowering your risk of that. So that's obviously maintaining a normal weight, eating a healthy diet, maintaining good sleep hygiene, reducing stress. That's all going to be beneficial in order to mitigate your risk of type 2 diabetes. I would also say smoking is a big one as well, and that can increase your risk of atherosclerosis. Yeah. And then also maintaining good blood pressure control. So less than 120/80, again, over a longer period of time. If you need to obviously mitigate that by using medication, then obviously doing that.
Yeah. And then in terms of diets, we've got lowered carbohydrate intake, which is linked to ApoB in ways that if you've got too much carbohydrate, it will find its way into triglycerides. They are transported around the VLDLs, which are a part of the ApoB family. So if you reduce your carbohydrate intake, I'm not saying go onto a ketogenic diet or anything, but it's this idea of using it within your means, then that will lower ApoB. The other one is saturated fat.
Yeah.
A complex pathway. So basically it's telling your liver that there's enough fat or resources within the liver. Yep. We don't need to accumulate it from the plasma, which means that we don't put any receptors on the liver, so they stay out within circulation. And then this means that this is output again in an ApoB molecule, increases the retention time, latency within the plasma. Both of them increase Apo B, and risk of cardiovascular disease.
Yeah. I mean, we can also touch upon like a low cholesterol diet. Obviously, we know that only about 10% of cholesterol from your diet is absorbed. However, if you already have high cholesterol, then it's important to, be thinking about the amount of cholesterol in your diet. And again, increasing the amount of plants that you're eating. So there is actually compounds in plants that can basically bind to cholesterol and then allow it to not be absorbed. So, I mean, we always advocate for, 30 different plant species a week. Because you're getting, antioxidant properties, you're getting obviously the compounds that, allow cholesterol to not be absorbed. And so, we would always advocate for that. But I think, that was quite a whistle-stop tour of Apo B and, why it's important and why we offer it as a test on Byolete. I don't think there's anything else that I wanted to say within this podcast with regards to Apo B. No, obviously we will go into probably more in-depth topics with regards to Apo B and HbA1c and all of the other topics that we will discuss. But is there anything else that you want to add?
No, just thanks to Spiritland because it saves us recording and editing our own podcast for this week.
I know.
But we're going to go into other topics, LPA and all the other cardiovascular markers to make up or complete the panel.
Yeah. I know. I second that. It was really nice to maybe see what it possibly could be like if we invested a little bit more money potentially and time into doing the podcast. Thanks to everyone for watching or listening on whatever platform you are on. If you haven't already, then please subscribe to our channels. We will obviously leave the link to our Instagram, YouTube, Spotify, Apple Music down below. If you know anyone who really would benefit from listening to this podcast, then please send it to them. But thanks for listening and we'll catch you at the next one.